We've convened the community panel to understand the needs of our community in relation to end-of-life care. We had 27 panel members come in and engage around the topic of end-of-life care and honing in and focusing in on a definition that the entire panel feel comfortable with.
Initially, I think quite a lot of us felt a bit nervous, and I was too, because I knew there was going to be a fair amount of friction or conflicts generated by the diversity. But in actual fact, with the help of the facilitators, the process went relatively smoothly and more efficiently than I thought possible.
I feel like my voice has been heard, but it's also been an opportunity to hear other people's opinions and to get a lot of ideas that broaden and shift my ideas a little bit. So it's been a great learning experience.
And it creates a situation where you actually meet the people, and the diversity of people is amazing, where they've come from and their ideas and everything else. It's been really quite educational for me.
I think this is a great step. We need to start a dialogue in the community to let people know what can be done, and we need to meet the wishes of the dying person. When we first started this process, I thought it's going to be 27 very different opinionated people with their own opinions, suggestions. But it's interesting to see how it's coming together.
And we accepted that there are, things that not everyone agrees on absolutely 100%, but I'm happy with the breadth and the depth of what we've achieved today.
Towards the end of today's session, they will be working on writing their own report, which is a very exciting concept for us as a PHN. And at the end of the day, they'll be formally handing over that report to our Executive Director for Health Systems Integration.
From there, we will look to how we can take those recommendations and use those to inform what we commission, how we commission, to improve outcomes for people at the end of their life, with the aim of increasing choice for people to die at home and bringing care closer to home for those people in our communities.
Community is the key for what dying well will entail, because when things do go downhill and you're unconscious or you're very, very frail, the support then needs to actually extend out to those supporting you so they can do that best, and that's community.
So we were hoping that we would get a much better insight as to what makes a difference for people, and therefore tailor our activities, our commissioning and our communication and supports to actually meet those needs.
If we were able to implement all the recommendations in the report today, I think we'd go a long way to achieving the aim of everyone being able to die well.